Okay, we're live.
Okay.
Just kind
You're going. Perfect. Hello.
of your puppy.
Oh man, I wish I had somebody give me treats like that. I'd sit down. Yeah, I'd sit down for treats. So who do we have here?
This is Riggs.
Riggs.
Mr. Rigglesworth.
Oh, I was going to say Martin Riggs from Lethal Weapon, but Mr.
Yeah,
Rigglesworth.
well, yeah, actually, Lethal Weapon.
Yeah, okay, there we go.
But then you had to cross into Austin Powers, Mr. Bigglesworth, his cat.
Yes, okay. Mr. Rigglesworth.
But he's our therapy dog here, so every patient that comes in, he's walking up to him. And just like when you get home, your pets come to say hi to you, forget about the day, right? That mental aspect is what
That's awesome.
he helps.
And what kind of a dog is it?
Golden Retriever.
Golden Retriever. It looks more like a russet retriever.
It's
A little on the red side, aren't
Irish,
you?
Irish setter.
Irish setter in there? Yeah.
That's what they think, I guess.
How we doing over there?
1 minute.
We got 1 minute. We're gonna wait another little minute there. Okay. Yes. My family always had cats. We
Certain
had
kinds of cats, or
Well,
just barn cats, or
I guess you could call it a barn cat. It was more like our neighbor's cat. They were house sitting it for someone who moved and couldn't have a cat. So like, okay, we'll take the cat. It turned out to be my brother's middle school teacher, one of them. But the family never took really good care of the cat. I would go as far as to say they'd abuse it. I call it feeding it Apple Jacks and pulling its tail abuse. So we finally let bowls of food outside our house, and he started hanging over. And then they just moved and left the cat. So we're like, come on in, Rum Tum. And he became our cat for the rest of his life. And he had this, from cats, Rum Tum Tugger. How would you do around cats, huh, Mr. Rigglesworth?
I don't know about cats. I'm okay with other dogs.
All right, I think we should go ahead and start the show.
Let's do it.
All right.
Let's do it.
Welcome everybody to episode, I think this is 12 of The Fields. My name is Jeff. If you're looking for Dr. Bex, she is staying at home in observance of Dr. Martin Luther King Jr. Day today. What's going on, Bex? I hope you've had an awesome holiday today. Today I am here with Blake Bell. He is the owner of Bell Chiropractic and Pain Management. Blake, thank you very much for coming on The Fields. We really appreciate it.
Pleasure.
And as we've already said, this is Mr. Rigglesworth. He's going to hang out with us for, I hope, the entire length of the show. Yeah? Oh, that's a lick of the hand. I'd call that a yes. Okay. So, why don't you tell me how Blake Chiropractic came, or Bell Chiropractic came to be?
We started in 1977. My father opened Bell Chiropractic here across Keys in Florissant. And now we're here in Old Town. And going on 45 years or so now, we've been doing this. And in 2018, when my father passed and I took over the helm, we became integrated. So we took chiropractors and medical doctors and brought them both together. So no matter what it is you're needing with your healthcare needs, we can provide it.
Okay, very nice. So what kind of services do you provide here other than chiropractic?
Well, yeah, chiropractic. So we do a lot of personal injury, things of that nature, with chiropractic, sports injury. But also we're starting to find that by introducing modern medicine to what we do, we can start offering things like regenerative medicine, PRP, stem cells, things of that nature.
PRP?
Platelet-rich plasma.
Okay.
Platelet-rich plasma. So it's actually that chair right there will draw 30 milliliters of your blood, take it out to the centrifuge and spin it. And then you're left with all the red blood cells on the bottom, a buffy coat, and then the plasma. And we'll take that plasma, extract it, and spin it again.
Okay.
And we're going to concentrate it down, and we're going to take all the platelet-rich plasma, which has all the cytokines, fibroblasts, and everybody's talking about mRNA, messenger RNA, right, because of what they see with the vaccines. But there's actually messenger RNA within all of your plasma that when you cut your finger and the blood rushes out, that's how your body responds and says, hey, this area needs to be healed. It's because it's already flowing through your blood. So what we're doing is we're taking that plasma and all of that rich stuff that helps you heal, and we'll super concentrate it and then inject it directly into the areas that need it so that your body can regenerate and regrow and become whole again.
That's some pretty high-tech medicine out there. When did you first begin to realize that cannabis was a medicine?
2010. 2010. I was raised around medicine. I was straight edge. I mean, even I played college football.
Straight edge.
I wouldn't touch anything. If it's not natural, it didn't need to be in your body. And even when I was doing two-a-days in college football, I wouldn't even take aspirin. It was just you just dealt with pain. as I started getting older, started learning, I've been taught that marijuana was bad, it will cause you to be stupid, and this and that, it kills your brain cells. But I started hearing from some different people that it was helping them. Okay, well, let's find out some more about this, because if you're saying it's helping with your anxiety, you're in pain, let's find out what it's doing to your brain. So let's start looking at the medical studies. But every medical study I pulled up wasn't showing that it was bad. I couldn't find the study that said it's going to put holes in your brain. I couldn't find the studies that said it's going to do this. Bad thing that I've been taught through my DARE education, right? Don't do cocaine, you do too much, it'll kill you. Don't do marijuana, you do too much,
you'll get stupid and you'll fry your brain in a pan like an egg.
So finally I started looking into it, and when you look at these studies, because I was brought up around medicine, when you're looking at it, you want to look at how the study was performed, were there controls, just the in-depth nuances of how it was performed. And when you look at, when they started saying it caused brain damage, it was because of a study from Tulane University, Dr. Heath. It's the Heath-Tulane study. The Doctor in Emperor Wears No Clothes is what book was wrote about it. But what they found out was, instead of him giving monkeys joints over a year period, small doses at a time, he just strapped a mask over their face and injected in 6 months worth of joints into his face in 5 minutes. What if you did that to me, or even Riggs? He's going to have brain damage. You've smoked him out so much that he's asphyxiated. He's not breathing. There's no oxygen going to the brain. So this guy in the 60s, the Dr. Heath at Tulane University, comes out with a study, and then they pass it out as if this is what marijuana is going to do to you. It will hurt you. It's detrimental to your body. But nobody told everybody how the studies were done. So once I start looking at this, I'm okay, somebody lied to me. Now I'm pissed. Don't lie to me. Don't lie to me. You can say something's bad for me, you can explain for it, but don't lie to me. So okay, let's go, why was it illegal in the first place? Now that I can't find any health detriment and why we shouldn't be using it, why is it illegal in the first place? Okay, now we go to the Controlled Substances Act, right? Now we talk to the doctors, the same thing with Dr. Baxter, these pharmacists, they're all working underneath the Controlled Substances Act from 1970s with Nixon. Well, why do they make the Controlled Substances Act that my doctors that sit in this office still have to go by? Well, if you ask John Ehrlichman, from Nixon's, his head policy advisor in the White House, he said, well, we couldn't make it illegal to be hippie or black, but we could make marijuana and heroin illegal and vilify them on the news every night and kick in their doors and go after them.
And if you want to go even further back, you can go to the 1937 Marijuana Tax Act.
That's the next step, going back even further, where you have, I forgot their names.
William Randolph Hearst, Andrew Mellon from the Mellon Bank.
What was the other guy?
It was DuPont as well.
I'm thinking of why can't I think of his name? He was the head guy for the U.S.
Anslinger.
Yes, Harry Anslinger wanted to go after Mexican people and blacks. That's where the word marijuana came from. Was from there. They wanted to create a word that sounded tropical or not normal to go after people that were using this. So if you look at the congressional records, you have Harry Anslinger saying it's going to cause black people to think they're as good as whites. That's why this is illegal? Are you kidding me?
Well, we went as far as even to say that black men would rape white women if they consume cannabis.
Yes, boom, illegal. Wasn't hard, boom, illegal, right away. So, okay, well, now I'm looking at the medical side of things. I'm having a drug that people say is working for them. It's my veterans friends are saying, hey man, I'm not blowing my head off because I can smoke a joint at night, but it's causing me so much anxiety, I'm afraid of the police kicking in my door and taking my kids away from me, and I don't know what to do. Okay, well, let's find out some more information, find out the true story, and then let's go, right, explain it to everybody. So one of the things I did, I created a not-for-profit, Project 422 Foundation, and we went and we took 22 veterans from all over Missouri to the Institute Cannabis Research Conference in Colorado, where you met with Dr. Raphael Meshulam, who discovered the endocannabinoid system, right? So much, I mean, I could go on for hours with Raphael. Dr. Sue Sisley, who just concluded the study with 72 veterans on incurable PTSD being treated with marijuana. Dr. Uma, just on down the line, all of these wonderful people. And the reason I want to get these veterans in front of them is because they can explain how these studies were done and how they're seeing that it's actually helping people from a medical standpoint. So now in front of, instead of me just sitting here saying, we will help you, it's good for you, sit with a doctor and they'll explain how it interacts with your endocannabinoid system, right? So now we have really educated veterans that could come back. And that was another thing that I'm really proud of with part of the legalization is being able to, instead of just saying, you know, weed should be legal or this should be that, we can explain just what it could do for me or you or our grandma or our kids or who else might be needing it.
How would you suggest that a patient have that kind of a discussion, a potential patient have that kind of a discussion with their family?
It depends. It depends. Put a little.
Let's say you've got a patient that comes to you, wants to get a recommendation for cannabis, which your practice here does offer as one of their services, and they say, look, I'm interested in trying this medicine, but my family more comes from an opioid background. If we have any kind of problem, we turn to opioids, but I don't want to go down that road, and if I tell them that I'm taking cannabis, they're going to feel like I'm not part of the family. So how would you help them sort of break the ice with their family about cannabis?
I try to think back to who I was before I became educated. I wasn't around people that smoked weed. If you did it, I'm not upset with you, but I'm just going to go in the other room. It's just not my thing. Because I wasn't educated. I didn't want to be around the smoke. I didn't want to cause problems for myself. So what are these same questions their family's asking? Are they thinking the same thing I was thinking back when I was uneducated? Okay, well then what's the problem here? They're uneducated. Well, let's talk to them. Let's give them these facts. You know, I've used opioids, it's done this and this and this, but the side effects are I can't use a restroom anymore because it's clogged up my system so bad that I have to use suppositories just to use the restroom. On top of that, I can't drive the car, I can't go to work, I'm completely laid on the couch, like all these other issues that come with it. And I think with marijuana, it might give me a different feeling. I might have a different response. I might be able to use, and there's a lot of patients that were coming and saying, let's 100 milligrams of tramadol, just to put a flat number on it. That's what they would take daily is 100 milligrams. But now that they've started using marijuana because of something called the entourage effect, the same reason you wouldn't drink alcohol when you're on opioids. It makes them too strong. You can overdose, right? But marijuana, you don't overdose. Marijuana, you don't. So what we found is that patients will use 10 milligrams of tramadol with marijuana. So now each dose 3 times a day. Now they're using 30 milligrams of tramadol instead of 100. Now what's happened with the side effects? The side effects are reduced. But we're still getting the same effect from that tramadol as 100 milligrams with 30 over the day because of marijuana. So by being able to smartly use them together, right, which is why you need a medical doctor, you know, because a lot of people think I just get my car and I go off and I'm fine. But if you're on barbiturates, if you're on Xanax, how many people come in on Xanax that are wanting to use marijuana because they tried it once and, oh my God, my anxiety was better than it's ever been. However, Dr. Sherman, whose name's right there, he's worked with people that have been coming off of being addicted to these drugs. And barbiturates are some of the most dangerous in the world. He says normally when people come down, when they start to taper off, that's when other people will say, okay, we need to reduce, the other doctors reduce. But the problem is that's when you're starting to go through withdrawals. So if you start doing all this on your own, you could die trying to withdraw off of Xanax or these other medications. So always have a doctor doing this with you. But we're finding that you can take less of those medications and achieve the same results or get off of them completely. I have veterans that were taking 11 or 12 different capsules a day. They're on two, because all their anxiety, their pain, these other problems that they were having are taken care of with the marijuana. And now it's just like high blood pressure medication or things that marijuana isn't really known for working with, right? So it's something that if you can educate your family on, which have them call me if they really have a lot of questions, or come in. I've had patients come in. That's why I have so many chairs in here. Grandma sits right here, mom sits there, dad, you know, her son, all these people, so that they can have that conversation with the doctor. And it's not just, here's marijuana, go enjoy yourself. The same thing when they come in a dispensary. They're going to have questions, you know, what's going to be the best dosage? What's going to be, what strain should I even try, right? Well, we're going to ask those questions. Well, what are you feeling? Are you trying it for sleep? Are you trying it because you want to be able to do the dishes without feeling all of these different pain, whether it be arthritis or back pain? You know, you're going to ask these questions at field state, right? So educating them, and if you're not sure about it, making sure you have a doctor there that can not only educate the patient but their family. That way, if the family's involved or if they're growing, or you know, if mom's sick and she has the flu and you have a caregiver, they know, you know, what to go to the store to get because they've got family involved with them.
Now, when you're educating these potential patients, how deep dive do you get in? Like when you tell them about the endocannabinoid system, is their mind completely blown?
Usually. So I was lucky enough to go to these conferences. I met with these doctors like Dr. Meshulam, who even discovered it, right? And with my background, I can understand it. So I always try to break it down to layman's terms on what it's actually doing for you. So I'll tell them, look, you have an endocannabinoid system. That's a big word. What does that word mean? Well, endo means endogenous. Damn, there's another big word. What does that one mean? Endogenous means your body naturally produces it. So you have a natural cannabinoid system within you. Endocannabinoid system, that's what that means, right? So now we've made this big word, now we understand I have a natural system within me that works off cannabinoids. CB1 is in the brain, central nervous system. CB2 is in the periphery, right? The skin and all these other things. There's different things with the organs. It works a little differently as well. There's more to it than that. But we can explain that and say, look, depending on your condition is going to depend on the type of products. If you have skin cancer, I don't need you smoking a joint, unless you have a lot of anxiety. But in that case, we'd rather have you go into field state and you get some RSO, right? Some FICO so that you can rub it directly on the area, because we're wanting to activate the endocannabinoid system on the skin, not necessarily internally or within your mind. We need to hit it right on the source. Or if you have prostate cancer, things like that, having a suppository puts it right on the source, right? So explaining, depending on how they're going to use, why they would want to use, because of your endocannabinoid system, how it's going to respond to what you're doing.
Okay. Let's see. What would we've noticed that some of our more needy patients are very quickly going through their 30-day of allotment. The state of Missouri only allows you X amount. It's 32 MMEs, or Missouri Marijuana Equivalency units. Each eighth of flower, or 3.5 grams, is worth 1 unit. Each 100 milligrams of infused product is worth another unit, and each gram of concentrate is worth another unit. So if you come into Field State in Florissant and buy 100 milligram Keef Cola, you buy a gram of Head Change concentrate, and you buy an eighth of Flora Farms flour, you will now have 3 of your MMEs taken off of your allotment of 32. But for a lot of our patients, they need the extra pain management, they need the extra symptom management. The state of Missouri does allow you to increase that allotment, but there are certain conditions. What would those conditions be?
Any of them.
Well, not qualifying conditions. How would a patient go about increasing their allotment with the state?
Well, to say something else on that, the state itself, the way we wrote what's now Article 14 of our Constitution was that this could be the smallest amount that the state could impose. So they could have said everybody could have 20 ounces, but the minimum we allowed them to do is what they decided to go with, was a very minimum. So the question is okay, well, if I'm needing more, I'm blowing through this. Well, usually in those cases, we're finding people aren't smoking 4 ounces a month. It's not because you're just all day sitting around, and that wouldn't be healthy anyways. But if you're using it for other reasons, a lot of times we find with edibles, concentrates, and things of that nature, you're going to go through that 32 real quick. I even keep it right here on my doctor's desk. 32 MMEs times 100, that's 3,200 milligrams per month of THC, right? So 3,200 milligrams per month. If you're an experienced user, and let's say you're using it, you have cancer, you have stomach cancer. Same reason I was talking about rubbing that oil directly on my skin, because I want to attack it at the source. Well, if I have stomach cancer, I'm probably going to be taking RSO or FICO oil, because I'm taking that in capsules to try to get it drawn directly to the source. I'm not going to be taking 10 milligrams. I'm not going to be taking 20. But when you have these types of ailments, you're probably going to be taking 200, 300, 400, 500 milligrams a dose, because you're putting that RSO to cover the whole area. You're trying to attack the cancer in your stomach. Well, 3,200 milligrams divided by 500 a dose.
So
it's not going to take very long, right?
So let's say someone's stage 4 stomach cancer, you would say that out of a 690 milligrams of THC in a 1 gram syringe, that they take the majority of that syringe?
Yeah.
Did I do the math right? Okay.
That's what we've seen. This is from my travels in Washington State, Colorado, working with people over the years. When they're, the problem was the department's, like I said, educated. They don't understand why people might be using this more than what the 4 ounces a month. So if you have cancer, if you're rubbing even on your skin, that's going to be a large dose Think of how big 500 milligrams of RSO is. It's not going to last long if you're rubbing it on your skin and covering it with a bandage 3 or 4 times a day. It's not going to go very far. So the doctor, what you do is you have a conversation. You have 2 separate physicians. Okay, the way we wrote this, you have 2 separate physicians that say, I need X amount. Okay, so let me break it down an example. You come in here, you sit down, you sit in that chair, and you talk with doctor number 1. You say, doctor, I have cancer, I'm using X amount per month. Would you be willing to put down that I need X amount because I'm using this for this? You'd have to have good reasons, right? Mm-hmm. Doctor number 1 says, okay, well, normal is 4 ounces a month. With the amount you're doing with edibles and what have you, I'm going to put you at 20 ounces a month. Okay, 20 ounces, you got one of the doctors. Now I need 2. So I go and see the second doctor, I sit down and say, doc, I need X, Y, Z. He says, okay, you need more than the 4, but I'm just going to go with 8. Okay, so I take doctor number 1 with 20, I take doctor number 2 with 8, and my normal is 4. That number from 4 can now go up to 8. Even though the doctor gave me 20, I've got 2 doctors that say I can have a higher amount.
And you go with the minimum amount.
The lesser of those 2 amounts is what my amount now goes to.
Okay.
So it depends on whatever doctor says. Now if they both said 10 ounces, you get 10 ounces a month.
Okay.
And that just translates to whatever you're needing for, edibles or whatever you're ingesting.
And with having multiple doctors here on staff, you were able to offer that service to patients.
All that. Yeah. We it's not something I don't necessarily go out advertising that, if you want higher amounts, come here. If you're a patient though, and you're having these issues, we're here for it.
You got to have a legitimate reason.
Yes.
Not just, I smoke so much all day because all I want to do is get high. That's not going to get you an increase in your allotment.
That won't work here.
Right.
That won't work here.
Okay. Now, how can some of our viewers, how can they become caretakers for their loved one? Let's say that they have a patient, a family member that can't get out there themselves to come to the dispensary. How can a family member become a caretaker for them?
It's as easy as registering online. So patient comes in, sits down, becomes a certified, state rules, here's your card number. Let's say it's a 7-year-old. How's a 7-year-old going to drive to the dispensary and get it? No. Mom needs to, but you can't put the cart before the horse. Patient first. After you have that patient number, the mom would apply with that patient number to be the caregiver for that child.
Okay.
So whether it's your neighbor, your mom, your grandma, it's the guy you just met, there's no real stipulations on who you can be a caregiver for. It could be anybody, but you would need to have them be a patient first, and then you sign on using their patient number. And you can also have cultivation status if they're wanting to do that. It's either the patient has it or the caretaker. So if you have that 7-year-old, like I was saying, that 7-year-old couldn't be a cultivator. Mom or dad, though, could apply to be a cultivator for that child.
Okay.
Does that make sense?
Yeah.
So, yeah, it's just a matter of making sure you have a patient first and then applying to be the caretaker for that patient with their number.
Okay. Let's see. How have you seen patients' lives changed by cannabis?
So much for the better. So, I worked from 2010 to help make it legal. Just going, whether I was collecting signatures or running events, different things. And the most exciting part for me was what we're doing right now. Seeing people like you were talking about that have never tried it before come in, and now they're off of those medications that they've been taking for so long. There's just so many different good stories, whether it's people with anxiety, cancer patients, my friends with PTSD that served overseas. There's just, the wonderful thing about marijuana is it's not basic. So much of our medications, even, all of the stuff I have over here, they have one single chemical, one single compound. It's, well, I wrote you a medication for this, now I'm going to add one more pill for that. But it's just one single thing. The thing with marijuana is you have terpenes, right? You have all these different, how many cannabinoids do you have on this plant? 400?
There are 200 cannabinoids, about 300 terpenes, and still others yet to be discovered.
It's unbelievable how much is going on. So it's a very, very complex plant. So the great thing about that is it's very, very complex on the people that you get that come in to use it. But just people with severe social anxiety that wouldn't even go out, seeing them come in and sit down with a smile and actually making eye contact when they're coming through the office because they're relaxed. up to the lady that's got terminal cancer in a wheelchair that says, you know what, I don't have much time left, but damn it, I'm enjoying it. How can you be upset about that?
I did a consultation the other day. It was a daughter and her 91-year-old mother.
Right.
And mom was just at the end of the rope with modern medicine and said, all right, my daughter's been talking about this for a long time. I'm going to come in and see what I can learn. And it was just a wonderful conversation.
Yeah.
She had her mind blown and thanked me for the education, because she wouldn't have got it in very many other places.
Right. It really doesn't have a whole lot of boundaries. In my opinion, it should be one of the first tools in the belt for healthcare. Because it is, when you look, doctors took the Hippocratic Oath. What's the first thing in there? Do no harm. If this is the safest option, well, do no harm. That's what you start with and work your way up. The same thing we do with chiropractic here, right? If you got a joint out, well, we can adjust it back in. We're not going to go with surgery right away, right? Let's take it with the safest, most economical option first and move our way up from there. Marijuana is just, it should be the first tool in our belt for helping people.
Well, I guess it's difficult for a lot of physicians because they weren't taught about it in school or taught to ignore it. But how would you convince a doctor to think otherwise? How would you get them to change their mind?
So one of my favorite things before it was legal was, I love sitting around talking about marijuana, but I really enjoyed going into the lion's den.
Okay.
I love my stoner friends, but sometimes you get tired preaching to the choir, right? I wanted to go talk to people that were against it. And I found that the best way to really start that conversation is just ask people what they think about it and find out how much they just don't know, right? With most medical doctors, it's, that's bad stuff for you, it just causes this, and this. Okay, I understand you've heard that, but have you actually read the studies? Because I can provide you. How about, what's your email? I'm going to go ahead, I'm going to shoot you over this study real quick that shows that one you were just talking about with Duke University. We were saying it caused in adolescence. That was one of the big studies. It was Duke University and Yale came out with these studies where they took kids, but they didn't have controls for other hard narcotics. They didn't have controls for alcohol. They didn't have cocaine. I mean, all these, they didn't have controls for any of that, but they wanted to come out and said that if you use marijuana, that you have a lower IQ as a child because you use marijuana, but they didn't have controls for any of these other things on there, right? So, okay, doc, I'm going to go ahead, I'm going to send you this because I know you're a smart man and you'll look at this and you'll understand that I'm not making this up, right? Because if I was, you'd call me out on it. But putting the information in front of them, because now it's not me and you fighting about it, it's, doc, I know you were taught X, Y, Z, but there's some new information I want to bring to light. Why don't you look this over and then we can kind of talk about the results and maybe kind of go from there. Because now I've planted the seed. Now instead of me just fighting with you or you fighting with me back over whether this is good or bad, let's look at the studies. Let's look at the science. Right?
Is there a database for people out there where they can find some of these studies that you're talking about?
If you simply go on Google, a lot of times you'll find a study, but the problem is that they have to have sources. Right, so if a guy on MSNBC writes a story, well, we got this story from so-and-so, and here's my write-up on it. Okay, I'll click that source. I'm going to go back source, until you get to the ncbi.ll, where you can see it's the actual, this is boring scientist stuff. And when you get to that website, that's where you get the actual meat and potatoes of how these studies were performed, where you can see these controls, where you can see how these, which 98, 99% of all marijuana studies that have been done to date were only for negative effects. That's the only thing they were looking for, negative, positive. However, they found so many positive. We're looking for the negative, then we have a lot of data because there's been like 25,000 plus studies on marijuana and its use, which I don't think there's really any other compound that has that many studies on it, any of them, right? So yeah, just putting the information in front of them and saying, you're an educated man. I know you were taught from the government that it's bad for you. You went through the DARE program like I did, but there's uses for this, the same as cocaine. Some people say, cocaine, there's nothing for that. You can't do anything with cocaine.
Then why is that medical grade cocaine?
I've got it sitting in a bottle behind you, but it's called lidocaine. It's just been suspended, and it'll numb up all your muscles. You can't get high on it like cocaine, but they've taken cocaine and they've put it into different forms. They found medical uses for it. It's the same thing with marijuana. And as we go along, and as things continue to progress, just like we've seen with CBD, all these different products and how it comes out, we're going to start seeing it even more with marijuana. It's where we're getting to things like nebulizers or just inhalers. So instead of people smoking weed, it's just an inhale. Keep on moving.
What kind of future do you see for cannabis, either technologically or at the chemical level?
The hard part is, like I was saying, is you always want to break things down in a single molecule. You want to break down to just THC, right? That's how we got Marinol, right? Marinol for cancer patients, right? It's just like, but it doesn't work. Why doesn't it work? It doesn't have its entourage, right? It's just like showing up to the Golden Globes. You're going to show up by yourself, or you're going to show up with a whole team of people, right? So that I see they're going to try to separate, which normally that's what we do with most science, but the problem is finding the right combinations where you're using other things besides just THC, just CBD, just CBG, where you're using these things in combination, including the terpenes, because the terpenes are what we found have unlocked the potential of CBD or THC, these other things. We've been seeing it with studies with kids with epilepsy. If you change the terpenes, even though everything else, all the other compounds stay the same, changing the terpenes will change the effects.
So are there any benefits to these isolated synthetic cannabinoids like THCO or Delta 8 or Delta 10 that seem to be getting a lot of attention these days? It's okay, you can be honest.
It's I see like the Delta 8 and things coming out. For me, I see it as just kind of a workaround to laws, which working with legalization for so long, I understand you're tired of waiting on the government, but you know, you can't give me for THC or CBG this or Delta 8, but you'll give me for Delta 11 or what have you. So they're kind of working around. I understand it, but I understand it, but I don't necessarily think it's the best thing. I think the legalization that we had, like at the state level and continuing at the federal level, will bring about the most changes, because then instead of trying to look for workarounds, we're actually taking the plant and finding what's best instead of just isolating this and trying to work with it. But when we can finally, even with the federal government included, not pounding down your backs, right? We have more than just Mississippi producing marijuana for these studies. Then we'll really start to find out what the potential is, because we see it. We've lived it. We've seen the patients who are living testimonies to how this works. But we want to have the data. We want to find out why it works. Why does one terpene work and one another not, right? So when we can start to get these whole plant studies and find out more, I think we'll really start blowing the top off of what it can be.
Okay. Well, I think I'm going to turn over here and ask our producer today, Nick, if we have any questions from any of our viewers out there.
We do. What is the average patient age at Blake's clinic?
Can't talk about it.
Can't talk.
Patient info. But I've had from people up to the hundreds to newborns. We've had them all. And then people ask, well, can my kid get a card? Yes. There's no, as far as restrictions.
Are there any special conditions that someone that is under 18 has to go through?
Nope, just this parental consent form.
Okay.
My dad sign off, have a birth certificate. But yeah, I've had very young children come through a door. I've had very old. There's no limit on it. It's medicine. Would you say what's the limit on Advil? It's medicine. If the kid's 6 years old, he's got a terrible fever in bed, he should probably do it, right? So.
Or for a sick puppy, right?
Actually, we've seen marijuana for dogs as well.
Well, like you said, with brain and the spine, you've got CB1 receptors.
Yeah.
He has an
He's a mammal.
endocannabinoid system himself.
Yeah, he's a mammal.
He's got a brain and a spine.
And it's actually one of the things we see with dogs, because we have a CBD line here. Very good pronounced effects with dogs with pain and other things, especially anxiety, aging, and it's safe and effective. They can drink a whole bottle and it wouldn't kill them or hurt them.
He's licking my hand like I had stuck it in barbecue sauce.
We had one more question. What is Blake's opinion on recreation, and how does he think it will have on the medical side of our plants?
I think it's good. I think we need, I hate the term recreational. I hate the adult use is what I prefer. It needs to be legal. Like we were saying, it never should have been legal to start with. It never, I mean, because we wanted to go after black people and Mexicans back in the 30s, and then we wanted to go after black peoples and hippies in the 70s. Like, when does this stuff stop? It should have been legal to start with. However, my concern is how we get to legalization. The same way that there have been issues with the rollout of this program, such as I was saying of putting only the minimums to where people need to ask for higher allotments, right? And they could have done a higher allotment from the start, but they chose to do the minimums that we had set. My concern would be that type of stuff going into recreational. You know, if we have recreational legal, what if you have over the amount? What if the amount is you can have 1 ounce in your possession and you have 1 ounce and a gram? Can I be a felon? Are we changing those laws? Are we changing those? Because I think of Jeff Mizanski, who was on the board of Show Me Cannabis. We freed him from jail from a life sentence for 3 nonviolent offenses with marijuana. He's not in favor of, I think, Legal 22, which used to be New Approach, even though these are the group that got him out of jail. Because that's the exact point he brings up. You can still go to jail for a very long time for marijuana. That needs to change. That needs to change. I shouldn't have to have patients worried about that. And even if you're not a patient, if you're just we're free people. Welcome to the land of the free, home of the brave. Why are we putting people in jail for marijuana? Let's focus on the real things.
It's true. You can still get busted for weed, and we're going to have a brand new segment soon to social media and our blog on My Field State. Bubba DeStash is going to take you on a state-by-state tour of how you can still get busted for weed. So stay tuned for your local social medias for that. Blake, thank you very much for taking the time out of your busy schedule to help us in here. It's Bell Chiropractic and Pain Management, Blake Bell, Mr. Rigglesworth, who's been given the love. Thank you, everybody out there, for giving the love and tuning in each week. Next week, Dr. Bex is going to return, and she's going to be taking the reins because she's going to be talking about how to do a medicine cabinet makeover. We'll see you next Monday, folks.